This is Black Mental Health Matters. I'm Dr. Carryann Williams. I'm a psychiatrist practicing in Massachusetts. And this is a podcast about everything related to mental wellness in the Black community and beyond. Today, I'm joined by Dr. Valerie Cordero. Dr. Cordero is the co-executive director at Families for Depression Awareness and a prominent voice for suicide prevention, mental health parity, and health equity. Dr. Cordero also has a PhD from UCLA in ethnomusicology, which is a field she will definitely have to explain to us in a little bit. So welcome to the show, Dr. Cordero.
Thank you so much, Dr. Williams. So good to be with you.
So tell us a little bit about yourself, tell us your story, and tell us what ethnomusicology is.
Okay, no problem. So I studied music throughout my undergraduate and graduate career. I was looking at the role of religion in music of the African diaspora. I did my PhD in religious music of the Protestant Revolution in Cuba and Havana and western part of the island. And I was in academia for some time, and then I made a career shift to nonprofit world. I began working for Families for Depression Awareness in 2010. And the cause is really close to my heart. I have family history of depression and bipolar disorder, also have suicide in my family. And so the cause made a lot of sense to me. And also a lot of my skills transferred to the nonprofit world. So that was a benefit. And so I've spent my career really at this organization in different positions. I've been co-executive director for about 6 years now, I believe. And our mission is to help families recognize and cope with depression and bipolar disorder to get people well and prevent suicides.
Oh, okay. Yeah. Tell us a bit more about Families for Depression Awareness. So you're helping families, you're preventing suicide, you're providing education. Tell us a little bit more about that.
I'd love to. So I probably don't have to tell you, but I will certainly tell your audience that when somebody is living with a mood disorder, so depression or bipolar disorder, or any of their forms, they're not going through it alone usually. They have spouses and children and parents and cousins and grandparents. All of these people are involved. And then hopefully they're all trying to be helpful and trying to be involved in a good way, but they don't always know how to do that. And so that's where our organization comes in. We really focus on the family caregiver with the assumption that if they are involved in a positive way, using great communication, they're partners in the care process and are just supporting that loved one, that the person dealing with the mood disorder will have better health outcomes. They will do better. They will get better and be able to weather the ups and downs of their mood disorder with that family support behind them. So we create educational programming, we do workshops, we do webinars, live stream educational events, we have publications, all of it really geared towards the family caregiver saying, hey, this is the role that you can play. These are maybe some things that are not helpful and that you need to think about. We also do a lot on self-care because caregivers can burn out pretty easily from supporting a loved one who's dealing with a mood disorder, especially if they have a chronic condition and are really feel the debilitating effects of mood disorder in their life. The caregiver can be stepping up and doing a lot of household chores or managing their lives and the children's lives and their siblings' life, and it can make them become depressed themselves. And so we talk a lot about how caregivers can take care of themselves, practice self-care. Sometimes they need their own therapist. Yeah. So that's a lot of the conversation that we try to have. So we're positioned within suicide prevention mosaic or the suicide prevention quilt, where you have organizations that focus on the person with the lived experience. You have organizations that focus on advocacy and changing laws and making sure parity is enforced. People who work to make care more affordable. So we are part of that mosaic. And we do believe we're playing an important part too in making sure that family members are not perpetuating stigma and again are wonderful partners in their loved one's mental health journey.
So are these kind of supports primarily available in the state that you're in, or is there a website where people can get a bit more information and maybe access resources no matter where they are?
Yeah, so our website is familyaware.org, and I'm sure it'll be in the description of the podcast. Familyaware.org is where people can find information and resources. And like I said, the trainings that we offer. We also partner with a wonderful organization called Courage to Caregivers. They do online support groups for caregivers and one-on-one support for them. And so we think that everybody should be able to access this kind of information, which is why we do website. We have a website. We do online education. If you have an internet, if you have internet connectivity, you can access it. And if you don't, we still send paper publications and mail them to people because we know that internet connectivity can be an access issue for people across the country.
That sounds like a great resource. I mean, I want to talk a little bit more about what mental health looks like in families, like how it shows up. What are some examples of ways that maybe people might not even realize that this is kind of what's going on even?
It's really interesting when people, sometimes when people are diagnosed, and if they're getting a good diagnosis, the person is going through a long family history. And sometimes people will say, well, there was always crazy Aunt Sally, or, it's really funny that our grandfather drank all the time. And we always just thought he was an alcoholic, and nobody dug into the trauma maybe that he had experienced. And usually when people do start looking into their family history, they will see signs of it, but maybe that person was never diagnosed. Maybe no one got them care, or maybe they didn't even know what was going on with them. And so that can be a sad thing to realize, that maybe that family member was stigmatized in the family, but they were having underlying mental health concerns that were never truly addressed. So the way that this can appear in a family, and I want to be clear that I'm not a mental health clinician. We've already gone over my background, and so I can just make some general statements, but people should certainly refer to mental health professionals for any diagnosis and things like that. But generally, if you have a family member and you see a change in them, if they used to be someone who was very outgoing or had a lot of friends or enjoyed maybe they weren't outgoing, but they had these one or two activities that they really enjoyed and now are not doing it anymore, that can be a sign that something is going on. If you're seeing extended periods of sadness, 2 weeks or more, or a lot of irritability, anger, and if changes in eating and sleeping, either too much, too little on any end of the spectrum, that's a lot of times what the family member notices first. My husband used to, Sundays were his days to go bowling. That was just his day. He always did it. He's not wanting to go anymore, and he's snapping at me so much. I wonder what's going on. That's when you can start and looking at those signs and take an online screening, or encourage them to go to their primary care physician for a screening and referral. And that's often what your family members are going to notice. They used to call me all the time, and they don't talk anymore. Or my loved one is just so withdrawn and is isolating away from the family. Those are things that the family members will see and want to know what's going on. What's happening. They may also know that some life experiences happen. They lost their job. They had the demise of another interpersonal relationship, or they suffered some kind of a traumatic event. These are indicators that you may want to keep your eye on their mental health and encourage them to get screened and to see a mental health professional if these are things that come up.
No, that idea of kind of encouraging someone to then go talk to somebody, go talk to the primary care doctor, get screened, that can be, sometimes intimidating for people, but I think that is the right way to go.
Yep. And I forgot to say, if you see them spending excessively or in ways that they hadn't before, if you notice heightened moods where they seem very excitable and speak in a way that might seem like they're having racing thoughts or incoherent kind of one statement has nothing to do with the other. These can be signs of mania or possible bipolar disorder. So those are indicators that they, again, might need to be screened. I just wanted to put those out there as well.
Because that happens as well. And sometimes people don't realize what's going on. They kind of wonder, especially children in the family might wonder what's going on with their parent and feel anxious. And so I think it's important to mention that because people sometimes they hold on to these things alone, especially if no one's they never knew that someone could go through that. They think, who can I even talk to about this? And so it's important for them to know that there's something that can be done.
Absolutely. Yeah. And it can make you feel alone if you're noticing these things and maybe other people aren't, or they say, oh, they're just going through a difficult time, give them some space. That can be a very isolating feeling for the family member. So it's important to maybe document your observations, see if anyone else, if other people say, well, I'm not seeing it, encourage them, well, just look a little closer over the next few weeks. Try to talk to so and so and see what you think, because these are the things that I'm noticing, and that's definitely not like my dad. That's definitely not like my sister or my cousin. Find those. You sometimes have to find those allies in the family that can help with that, so you don't feel so alone.
And I think that's a key thing. One of the questions that I hear all the time, one of the most common questions I get is, I have a family member who needs help and I don't know how to talk to them. I don't know how to encourage them to get help. And I imagine that, Families for Depression Awareness, that's something that comes up all the time is, I really want to help my family member, but maybe there's something about the aspect of the treatment they're disagreeing with. Like, for example, maybe they are struggling with very severe depression, but they may not want to take an antidepressant, or they don't want to go to therapy, or, whatever the case may be. And this question of, how do I help them if they're not accepting the help or the advice?
We do hear that a lot. Unfortunately, that is something that family members come up against. And there are a few important things to remember. Number one, you can try to approach them in a calm way, in a circumstance where there's not a lot of distractions, or maybe not even a lot of people, and you can try to bring up your concerns and in a non-judgmental way. So sticking to observations, not judgments. So not, why have you been such a jerk lately? But I've noticed again that you don't go out and do this anymore. You used to love watching anime and you don't do that anymore. I'm wondering what's going on. I wonder if you have depression. Can we take these steps to maybe see if you do, and if you need more help? And you can try to have those conversations. If they're open to it, that's fantastic. If they're willing to go see a mental health professional or start with the PCP, then you can take it from there. If they're not open to it, or if they've been open to a certain, as you said before in your example, if they were open to go seeing a professional, but the professional suggests something or a bunch of things that the person just doesn't want to do, or they change their mind, they say, you know what, I don't want to go through this. I don't think there's anything wrong. Then there are things that you can do as the family member. You want to, as much as you can, maintain that relationship and support them. You have to realize that within the stages of change, there are many stages of change. Somebody can think about, somebody can go from not thinking there's a problem to thinking there's a problem, but not really wanting to do anything about it, to wanting to do something about it, but just still trying to go back and forth between those stages, to yes, I'm going to do it. And then they can start the cycle all over again. And it's important to know as the family member that you don't want to force them into anything. For that change to happen and to be sustained, it's much better if they are partly in the driver's seat. There's a whole team. You have the professionals, you have the person who's dealing with the lived experience, you have the family members. They should be working as a team, but following the goals and the desires of the person. That's just where it's going to end up being the best. Now, this is not, we're not talking about if somebody is in severe danger for themselves or a danger of hurting others, where that might necessitate other kinds of interventions. But generally, you want that person to be making that decision. You want to be supporting them. And if they go back, well, you can still have the list of therapists ready. You can still know which pharmacy you need to go to get the medication in case they change their minds. And then you want to say, okay, you want it? Oh, I know exactly where to go. I know exactly how to pick it up. You can still be there and be ready and be providing them support and still observing their behavior and supporting them the best you can. But it is definitely better for that person to have made that choice and be ready to follow through with treatment if you want it to last. Sometimes that's not what happens, especially if somebody has dealt with an untreated mental health condition for a long time. Family relationships can get fractured. You can say, well, because of this, this person is constantly yelling at me. They're treating me poorly. They're the way it shows up in them is more of that anger or that irritability. And I can't take it. I'm not going to be yelled at every day. You can say, if you feel this way, I have to remove myself, or I have to, I have to change some things for my own mental health. You can do those things, because it's really true that process can take a long time, and there can be hurt feelings and broken relationships that happen as a result. That's why we also like to encourage people, try to intervene and help and be a part of this process as early as possible, because when somebody is in those more extreme circumstances, it can be more difficult, especially with things like bipolar disorder, where they can lack insight. They can not be aware of how poorly their mental health is doing, or think that they're just being themselves, and so it can be a lot harder to support them in that journey, because you're like, well, look, I can't co-sign this. I have to try to maintain some distance until until you're ready to move forward, if that's the case. And those are hard conversations. Sometimes we tell caregivers, yeah, you did everything right. There's nothing that you haven't done. It's just they're not ready. They don't want to, and they're not an immediate danger to themselves or others. So you have to just be there and be ready if they do change their minds.
And I think that's a tough part, right? Is sometimes not being able to kind of influence quickly, but having to be patient and wait for that person to come around and to be ready to make that change. And I like what you kind of mentioned about having more of a supportive stance and not kind of just coming in and being kind of this force trying to kind of make things happen. What we know about human nature is the more someone tries to control you, the more resistant you get, the more you try to push back and regain control of the situation. And so coming alongside someone and supporting them and making them kind of maintaining that relationship with them, and exploring what's important to them and how their decisions match with what they say is important to them and all of that. But you're right. Sometimes it's, you did everything right and the person just isn't ready. And they're not a danger to themselves. So you can't really intervene in any other way. You just have to kind of wait a bit, which can be tough.
It can be. And people often feel like that's not doing anything, but it is. It's just, you have the resources ready, you have the information ready, and you continue to encourage them. You continue to try to support them in the ways that are not detrimental to your own mental health. But then you just have to wait, and that's doing something. That's preserving the relationship so that when they are ready, they will come to you, or they'll feel comfortable talking about it with you, because you haven't been, trying to force them to do things your way and on your timetable. So that's really, really hard. We've talked a little bit around what the different situation is. If somebody is talking about ending their own life, if they have a plan, if they have means to do it, that's definitely a different situation. There is a crisis number you can call, 988. To get support and resources if somebody is in a mental health crisis, and or threatening to take their own life. You can get more immediate resources in those situations. So we also want to encourage people not to wait. If somebody, there are a lot of different suicide warning signs. So I encourage people to look that up. We have it on our website. You can go to other mental health organizations like the American Foundation for Suicide Prevention and look at the suicide warning signs, giving away prized possessions, talking about not being here anymore, somebody suddenly being upbeat when they were very, very depressed before. These are some of the warning signs. In that case, family members, again, don't want to wait. You don't want to leave that person alone. If you know they own a handgun or they have other means, they have a stockpile of pills or anything like that, a means to end their own life, you definitely want to intervene. Call 988, or if you need to, take them to the local emergency room, and deal with that more immediate situation.
Thank you for sharing those warning signs. I think it's important for people to trust their instinct and trust those hunches. If you have a family member, particularly, an adolescent or a young adult or just any family member that has been struggling, and you see these kinds of changes, like suddenly they're out of the blue, just upbeat. They've kind of made a plan in their mind, and they're giving things away suddenly. These are all things that people might look at and say, that's strange, but they may not really realize that that's a sign that, someone's kind of giving away something they feel like they won't need anymore.
Yep.
And so as best as possible, when you see those things, let someone know, call them. Now, can people, is a hotline helpful for people that are looking for support for a loved one, or is it just for, or would they just go to other resources if they're looking for support for a loved one that they suspect may have suicidal thoughts?
If you think they might be having suicidal thoughts and there is a risk for them to take their life, definitely call 988. If you are generally, like I said, if you are trying to help them get screened or get a mental health evaluation, you can start with their primary care physician, or you can look for a mental health professional right away. One of the reasons why we suggest primary care physicians is because assuming that person already has a relationship with that provider and can get in to see them more readily and more easily than they can sometimes a mental health professional, because there are few of you who are available, and lots of people who need the help. So sometimes a good first step is to go to the primary care provider. If the caregiver is just looking for general resources, of course, I would say our website, familyaware.org, which can give you some ideas of how to go about seeking care, paying for care, things like that. And then again, we differentiate it. If you think somebody is having suicidal thoughts, it's better to be safe than sorry. I mean, it's better to call and get the information and get the resources. They may tell you, well, we don't think that person's in immediate risk, and these are the next steps you should take. So it's not bad to call and then find out that the person is not at risk, because then at least you know what your next steps are. But so yes, I would say still call if you're worried about that, if you think that could be something that's going through their minds. They can also, of course, call for themselves. But if you're the one who's worried and you can't get them to want to do that, then you can call yourself.
And, the thing that I think about with the primary care appointment is that some primary care offices even have mental health specialists within them. There's integrated care. Now, not all, but some of them have like this integrated kind of care model where they'll have people of other specialties, like a mental health specialist in the clinic with them. So when you go for your primary care appointment, you might be able to potentially have this appointment, and it helps to increase access to care in some places.
Absolutely. That integrative care is a great development in that area. In just the way you said, you might be able to be screened by the primary care provider, and they can get you to see somebody else pretty immediately who's within that same practice or within that same care model. And that can make it feel more seamless. We want to take down as many barriers as possible to somebody getting help and seeing somebody. And especially want to, a theme that people might hear from what I'm saying is, you really want to take advantage of those moments when somebody is open to getting screened or seeing a professional or getting care, or maybe just making some lifestyle changes if they're only dealing with a mild depression. You want to really capitalize off of those moments and get things moving as efficiently as possible within a broken mental health care system.
And folks that are listening, we're sharing this so that you can feel empowered to take action. If you still have the chance to. We understand that there's people that are listening who may have already lost someone. And it's important to know that sometimes we just don't see the warning. Sometimes there's not really warning signs, and you didn't do anything wrong. It's not that you did something wrong or that you didn't try hard enough. Sometimes there's just the warning signs aren't there. or they are just so subtle. It's so easy to miss. And sometimes even when we see the warning signs and we do everything, we think we're doing everything we can, it's still a decision that person makes for themselves. And so, if that's something that you're going through as a listener, that you've already lost someone, that's something that's their support for that as well. And there's a lot of feelings that go along with that. Does Families for Depression Awareness ever work with families that are dealing with, losses, bereavement?
We do. A lot of those people are our supporters or our volunteers, for the reasons that you were just saying. They sometimes they feel like they missed something. Sometimes they feel like they did do everything they could, and the person still made the choice to take their own life, because of the deep level of pain that they were in. And so those family members often do come to us so that they can use their experiences to help others. That's always a very powerful exchange that we have with those loss survivors, because they are dealing with a pain that it's difficult to even describe or quantify. And we don't want to compare different kinds of suffering, but definitely parents who've had to bury children, that's a pain that is indescribable, and that I know we would never want to feel. And so sometimes using those experiences to help others is the way that they cope, that loss survivors are able to take those horrible experiences and help other families. That's actually how we were founded. The woman who founded our organization, her name is Julie Totten. She lost her brother to suicide in 1990, and she had felt alone and responsible and felt like, what did I miss? And how could this have happened? It was just the two of them as siblings. And she, at that time, if you think of what we have now and 30 years ago, there was even less information and awareness, and not as much connection in public discussions between untreated mental health conditions and suicide. You can probably remember a time where suicide was looked at as a moral failing, as a weakness. Somebody did that because they just couldn't hack it. They just couldn't take it. And there were times when it was looked at as a sin. It's somebody they must be in hell because they took their life, instead of looking at suicide as the result of somebody in deep pain, who has come to the end of their abilities to cope with that mental anguish, and who have not had the right interventions. Most times, as we've already noted, sometimes somebody gets all those interventions and still take their life. But I don't think that's the majority of cases. And so she felt like there was not enough information, not enough stories about how families can identify mental health conditions and help and support their loved ones. So she started Families for Depression Awareness in 2001, and that was really her mission. She wanted to build awareness around mental health. When I came to the organization in 2010, we were shifting away from awareness building to more action-based trainings and support and resources for caregivers, so that they could be aware. Okay, now we're aware. let's move you towards action. What can you do now that you know that these issues can exist, and how can you help? And that is what ended up happening with Julie. She was able to get her father diagnosed with depression, or she didn't get him. She supported him through his journey to become diagnosed officially with depression. And those two experiences she had, one where she had little information, where she didn't know what she was supposed to do, where she felt alone and responsible after the death of her brother. And that juxtaposed to that other experience where she had educated herself. She knew what to look for. She knew how to be a supportive loved one. And then her father was able to have the right interventions to support him in his life. Those really stuck out to her and was the founding of our organization. So my heart goes out to anyone who's lost a loved one to suicide. It is incredibly painful. It's something that is hard to describe. There still is a lot of stigma and shame around it. And sometimes people don't want others to know that their loved one took their life. And so those suicide loss survivors deserve support and and encouragement, and they deserve to feel like their loved one's life mattered and their loved one was in pain. They weren't somebody who was weak or somebody who had a moral failing. They were someone who was dealing with something that would just ultimately overcame them.
Yeah. Definitely important to kind of to talk about, and it makes me think about access to care and early kind of intervening early, as you mentioned. If you can help people to get the help they need early, sometimes it can mitigate some of the risk factors at times. And one of the things that I think about, particularly in diverse communities, is the idea of our choice of words when it comes to mental health. The language that we use, I know as professionals, we often use the term mental health. Some people don't like that. Sometimes people don't even like the word, the term mental health. They prefer to say emotional wellness or, some other kind of variation. And there's a lot of things, even depression. People may not say, oh, I'm not depressed, I'm not sad, but they may be irritable. They may be unhappy. They're not, enjoying life anymore. But they wouldn't say I'm depressed, but they're experiencing actually meets the criteria for depression. And so this idea of language, but also the stigma around language. Well, I'm not an alcoholic. I just, I have a couple of beers with dinner, everybody does that. Right. Tell us a little bit about how you think about the use of language and stigma and in the work that you do.
It's a big deal. The words we use do matter, and we can either be reinforcing stigma with our words or trying to eliminate it, get it out of our vocabulary, get out that sense of judgment on people who are dealing with a mental health condition. Once I've started doing this work, there are certain things that I can't unhear, and I can't I can't hear them in movies or in conversations or see them on social media and just let them go by, because it makes me mad. It makes me want to tell people that's not really what you say. And it still happens today. We do try to, not only as an organization, use appropriate terms and language and try to keep up with changes in how diagnoses are classified or what symptoms are called. So we do try to keep up with that on a professional level. But also personally, I hear people talking about someone committed suicide. And that's not language that we use in the suicide prevention community, because you commit a sin, you commit a crime. And again, that stigmatizes people who are dealing with suicidal ideation, suicidal thoughts, as people who are doing something bad morally, as opposed to people who are suffering. I hear in TV and movies all this time still the word bipolar used to describe somebody who is unbalanced or crazy. It's like, oh, she's so bipolar, or why did I have this bipolar day? And that's not a good use of words, because people dealing with bipolar disorder have a medical condition that is not supposed to be a punchline in somebody's joke. And so whenever I hear or see those things, I try to do my part to gently, without being the bump on the log, tell people that's not really the language that you should be using. That's really stigmatizing mental health even further. It definitely still happens in the Black community, of which I'm a part. And I try to, within my own people and my own groups of Black friends and family and people I know, try to talk about mental health in a way that shows that I don't use stigmatizing language, and that people shouldn't do that. And we shouldn't throw around terms that make, also, you never know who is dealing with it themselves or who is dealing with it in their family. Chances are, if you're in a room of 5 people, that 5 people have been affected by it, either themselves in their immediate family or their extended family. They know what it's about. And so, because you never know who you could be, because you never know if your words will stop somebody else from seeking help, or your words will put somebody further into secrecy around something they're struggling with. You never know when that's the case. So just don't do it. Find another word, find another phrase. Don't use language that could make people who are dealing with mental health struggles or their family members feel like there is something inherently wrong with them, because that does not happen in other health conditions as much. I mean, you don't hear people making the same kind of punchlines, hopefully, about pediatric cancer or about, liver disease or, other things. But with mental health, it can sometimes be a carte blanche for people to make fun of and to further stigmatize. And it's just something that I don't tolerate in my regular life. If that makes me the killjoy at the party, then that's just me. But like I said, once you learn and you hear and you hear these stories and you talk to people who have felt like they couldn't be honest about what they were struggling with, it gives you a different perspective.
Yeah. Yeah. So then the phrase would be that someone died by suicide.
Died by suicide, took their own life.
Okay.
Any of that would be good, without going into detail about the means that they used to end their life. That they died by suicide, that they took their own life. That would be a language that does not further stigmatize someone who dealt with a mental health condition.
Okay. So what about, suicide rates in the Black community? I think sometimes we have a sense, because people like to kind of hold this information so close, we sometimes think, well, these are things that happen to other people. They don't really happen as much in the Black community. And it seems as though there's some numbers more recently that actually say otherwise, that there are actually, it's important for us to know what's going on in the Black community regarding depression and suicide.
Sure. And I'd love to share some of the statistics around this issue so we can hear what we're dealing with when we talk about suicide in African American populations. These numbers come from the CDC, the Center for Disease Control. So suicide rates among people 10 to 24, African Americans 10 to 24, increased significantly from 2018 to 2021. There was a 36% increase in that population, 10 to 24, over that period of time. The death rate for Black or African American men is 4 times greater. The suicide death of African American men was 4 times greater than African American women in 2018. Black females, grades 9 through 12, were 60% more likely to attempt suicide when compared to non-Hispanic white females of that same age. And we also know that there are what's called social determinants of health. So where you live, what you eat, what you're exposed to, what's in your community, those issues can further provide a risk factor for somebody to die by suicide. So just one example is living in poverty. Poverty levels really do affect mental health and mental wellness as well. So African Americans living below the poverty level, as compared to those twice the poverty level, are twice as likely to report serious psychological distress. That's just one statistic. But as I said, lack of access to stable housing, lack of access to mental health care, mental health support, racism and discrimination. These are factors that can play and increase somebody's risk for mental health concerns and suicide.
Wow. And it's so, it's interesting that statistic lines up with what we're actually seeing where I'm located in the city of Boston, is that that young Black adolescent female is now a target area for mental health intervention, because the statistics are showing them being at risk for suicide.
Absolutely.
And it's one of those things that I think people probably would not have assumed because of, lack of information or lack of seeking that information that was available from the CDC, but the rates are going up. And so it's lining up with the data, I'd say, all across the country. Yeah.
Yeah. And generally, speaking about female suicides, there tend to be higher rates of completion among males because they tend to use more lethal means where there's no intervention to be had medically. Female attempt survivors tend to use less lethal means. So, for example, pills where you can have your stomach pumped and can be saved. And so, but it should show that it is such a problem. Just because their suicides are not ending in death doesn't mean that this isn't something that we should be concerned about and looking into.
Exactly, because, unfortunately, there are cases of people who have attempted several times, and one of the attempts, they did pass away. And that's so, it's one of those things sometimes is in the mental health field. When someone has multiple attempts, there's kind of this discussion about what their risk is ultimately. But it can happen to anybody. And in a lot of different kinds of situations. And so it's just important for us as a community to come together and really pay attention to who kind of needs this special. I mean, everybody does, but there are certain groups that definitely need a very close eye. And I think those young adolescent females definitely need some extra attention. I think girls tend to be so quiet about some of these things. It's even, not to go on a tangent, but there's even certain diagnoses that get misdiagnosed in girls, because when boys have it, they're more disruptive. When girls have it, they're not as disruptive. So it gets missed in girls. There's a few diagnoses like that. And I'd say depression can be one of those things sometimes too, is girls, especially, they're very intelligent and may do well in other areas. We may not realize how severely depressed they are internally. So.
Yeah, but I think parents should know that they have things that they can do. Speaking about Black parents and all parents, but particularly to you Black parents, there are things you can do to foster positive mental health in your whole family. You can be talking about, as we were mentioning earlier, talking about mental health in a way that's not stigmatizing. Saying, cousin Keisha had to start therapy. She was dealing with some very difficult emotions. And I'm just so proud of her for reaching out for help and addressing it. That's a conversation you have. And so then your children are picking up on those clues. Oh, there's something that can be done. It's not bad to ask for help. They can pick up those clues. Encouraging that open dialogue so that if something is wrong, that your children feel comfortable coming to you and talking to you about things that they're struggling with their emotions or their mental health. Also making sure that they have extended connections within their community, within their the people around them, so that they have multiple trusted adults that they can go to, people who are watching out for them, and they feel a part of a larger family and community, and that helps them. If you do have religious beliefs, whatever they are, making sure that your children are connected to those. And if that religious belief supports good mental health and gives positive messaging around mental health, making sure they're connected there. All of those things can help shore up their protective factors. So parents don't have to feel paralyzed by knowing, oh goodness, is my teen daughter going to start thinking about suicide? Oh my gosh, is my son gonna try to take his own life? Take positive action, speak about mental health in a way that's not stigmatizing, that's encouraging of people getting help, support positive family connections and community connections, get them involved in things that they're interested in, whether that's through volunteering or activities, and making sure that they're having those full lives. And then if something comes up, if you are noticing those symptoms, intervening before things get really bad. If you see these changes and they're going on for 2 weeks or more, say, well, why don't we go see Dr. So-and-so? You really connect with them, and let's just talk to them about what's going on, see if there are any medical issues that we need to rule out. And if there are mental health issues, we'll deal with that too. So parents can feel encouraged that there are steps that they can take to help avoid their teens or their young children from getting to a point where they're severely depressed or having undiagnosed issues.
Yeah, I like what you mentioned about the having a supportive person in their life. I'd say, guys, ask a young person for fun. Ask them, who in your life would you go to when you have a problem? Who do you talk to when you need to talk to someone about what's going on inside? And, it's a good sign if someone does have a person. And if they don't have a person, that's a bit of a bad sign that there's no one that they can go to when they really have a serious problem. And so that might be a young person that you identify as someone who needs more support.
Yeah, and you're not always going to be the trusted adult in every situation. That's okay. Maybe they feel more comfortable with aunt so and so, or maybe they feel more comfortable with grandpa. Maybe they feel more comfortable with a certain teacher at school for one particular issue or another. That's okay. As long as you know that those adults are upstanding, are going to give them good advice and are good people, then that's okay. It's just important that they take that first step and that they open up. And then that coach or that family member can come to you and say, hey, your daughter came to me. She has these concerns. She said it's okay if I talk to you about it, but this is what she brought up, and maybe we can talk about what you can do next to help her out.
Yeah, takes a village.
It does. It truly does.
So as we kind of wrap up, I like to ask my guests at the end of the show, what are their kind of just top general tips for mental wellness, just for promoting your own wellness for individuals? What are some of the things that maybe you do or you recommend to people to do just to boost their mental wellness?
Number one, you have to carve out time for yourself and for your hobbies, your interests, your activities. You have to, for those people on the call who have a very busy work life, very busy home life, you have children, or maybe you don't, and you just have a lot of competing priorities in your life. It's so important to take that time to nurture the parts of yourself that make you fulfilled. And so that can look like doing that activity you love. That can look like a self-care activity. So find the time. Sometimes I tell my kids, Mommy's on a timeout. Mommy's having a timeout. I'm just going to close the door. I just need an hour. I will be back. If there's an emergency, tell me, but Mommy needs her own timeout. And I just take that time because I need a moment to decompress. I need a moment to get back to center. And so don't be afraid to take those moments for yourself when you can. Try to be intentional about it too, and cultivate those things that really make you feel like yourself as a person and not just an employee, a parent, an adult child of somebody, a caretaker. Find that time for yourself. I believe in spiritual practices, and I find them to be very calming. And for people, that might look like prayer, that could look like meditation, that could look like deep breathing in a corner with a candle lit. But finding those times to connect with something greater than yourself, even if it's just sitting outside and looking at the trees, feeling the grass, finding those contemplative practices, because we can often feel like insignificant specks in a world, and it can be hard to find the quiet. So I encourage everyone to find some kind of practice that speaks to them, no matter what the belief system is behind it, or if it's just, like I said, sitting down and outside and getting some sunshine and breathing some fresh air. Find time to do that, and to cultivate the quiet time, so that you can really get yourself more centered and present in your body. The last thing I would say is just be kind to yourself. Life is hard, whether you're a caregiver of somebody dealing with a mood disorder, or you're just another person trying to live every day in a world that sometimes feels like it's falling apart. It can make you feel sad. It can make you feel, like I said before, insignificant. And we are sometimes our own worst critics. And it's hard you can silence people outside of your body. You can close the door on them. You can turn off social media. But if you are constantly telling yourself negative messages about yourself, that's something that it's harder to run away from. So be kind to yourself. Speak positivity about yourself, even when you don't feel like it. Fake it till you make it, and be kind to yourself even before you're kind to other people. Because if you hate yourself and if you're cruel to yourself, that can then be pushed out to others. So start with showing yourself kindness, showing yourself empathy, and being gentle when you fail or when you make a mistake, so that you can then give that to others. And there's something unique and special about each of us. So tell yourself what it is about yourself. Remind yourself that you're human, you make mistakes, and give yourself another chance. And that way you can do that for others.
Thank you. Thank you so much for sharing your wisdom with us today. Thank you for sharing all those information for all that information for families. I feel like, as I said, it's just something that people ask about a lot. And so I think it's very valuable. And so thank you for joining us. And thank you for all the listeners that have been listening today. That's it for today's episode. Remember this week to just be open, be honest with yourself, be compassionate with your family members and with their vulnerabilities. Take care and have a great week.